Follow us to stay updated on debates, discussions, facts, and tips about health. Click on the subscribe button and the bell icon for latest updates.
Did you know that diabetes is a global epidemic and is expected to be the seventh leading cause of death globally? Unfortunately, there is no cure, but education, early detection, and access to healthcare can help in managing the disease. Hi everyone, welcome to our channel, The Healthy Indian Project, and today we are back with another episode of Health Files. I am Dr. Shikha, your host for the episode, and today we have a captivating interview in store for you. We are privileged to engage in a thought-provoking conversation with Dr. Altamash Shaikh, a distinguished endocrinologist renowned for his expertise in diabetes management. Currently, he works as a senior consultant endocrinologist, diabetologist, and metabolic specialist at several renowned hospitals in Mumbai. Join us as we delve into the world of diabetes from the doctor's side. Hello, Dr. Altamash Shaikh. Welcome to THIP Media.
Hello, thank you.
Pleasure to have you, sir. Since we already know that diabetes is such a big disorder in India and the cases of diabetes are increasing day by day, what do you think fuels the existing burden of this disease?
Well, that's a very interesting and important question because as you see, from no diabetes to being world number one in diabetes, now we are second at the moment. But if diabetes fueling does not come down, we may again become number one in diabetes in the world again by 2035. So I think what's more important is we are actually having a lot of or lack of physical activity. That's a very important thing. Number two, we are a very carbohydrate centric population where we eat a lot of carbohydrates in different forms, and that's been a tradition which may be fueling to that. And number three, I think very important, which has come, is the digitalization. Everybody has a mobile phone or an iPad or a notepad in their hands, and most of them are not even aware about what's happening. I'm sure when people watch this kind of an interview, they are still on some other device also parallelly, and that's called as loss of situational awareness, wherein the sudden looking at watching the videos like TikTok or others may cause a dopamine hit, and person may lose a lot of either emotional stability, can get a lot of anger, and all these things clubbed together, they do cause increase in risk of type 2 diabetes. So I think we are looking at increase in obesity, we are looking at decrease in physical activity, we are looking at increase diabetes at various ages. What we were seeing earlier, we don't see that now. So these are those important factors for diabetes.
Like you just mentioned, that the prevalence of diabetes has increased in various ages. Like there are different paths, and the growth has been enormous. So, how do you tailor your diabetes management as per the age? Like, what would be the diabetes management for the older population, and how would you tailor it for the younger population?
Fine, that's another interesting question that you've asked. So if we look at a younger population, we understand that they are yet to grow fully to their adult potential. If you talk about type 2 diabetes in children, or if you look at a type 2 diabetes in a youth population who's just started working, they again have a whole lifespan in front of them. So that would differ, that we would first want to reduce not just diabetes, we would want these people to go into diabetes remission. So we would look at their risk factor. If obesity was a risk factor, we would want them to lose weight, get out of the obesity thing, overweight thing completely, and be off even the tablets if they were started on the first place, and or prevent complications. In 2023, we first look at not controlling diabetes, we look at a good quality of life, number one, and we look at controlling the complications. On the other hand, for the elderly, if we look at more than 65 years and with diabetes, we look at first is giving a good and actionable and impactful life. We want to avoid the iatrogenic complication which can arise from treatment or over treatment, that's called as hypoglycemia. We do not want in such people to for the glucose to go down during treatment. We also look at the existing complications because longer the diabetes, more the complications. So lesser the age of diabetes, lesser the complications. And if you look at them, we want to avoid hypoglycemia, number one, as I said. Number two, we want to avoid falls because falls also would increase their hospitalizations. They already are having risk factor of age and others for heart diseases. So we would want to look at controlling hypertension and cholesterol in them, avoid kidney disease and brain diseases in them, and of course, peripheral neuropathy and diabetic foot. So more the age, more the complications, and we would look at it from these two different angles. At extreme of age, in the younger ones, we are looking at prevention of these, and in the elder ones where they have already happened, we look at tertiary prevention of complications of diabetes.
In continuation with this answer only, can you discuss any societal factors that play a role in diabetes management? And if so, how do you handle them?
Oh, that's another really good prong for treatment of diabetes. Diabetes is a social disease. If you look at that angle, we have a lot of tradition of, as I said earlier, also that about it's a eating culture. It's about sitting culture. It's a talking culture. We are more humanistic than any other country across the world. So we like to meet. We love to talk. We love to chat, and we love to eat chart. So both the ways, I think that causes kind of increase in the density of food that we eat, increase in the density of carbohydrates that we take. And one is, be it any occasion, always we are very much good in savories and flavories of the food. So that needs to be looked into. But I also look at that, let us have some gatherings and some societal factors where we cut a cake instead, we cut a fruit instead of cutting a cake, where we have a healthy walk, jog, or a sport instead of sitting and just watching the a movie or a serial. So these are those important societal factors which can come into play. There are many, many more also which could come. For example, because my friend or my neighbor is buying a certain amount of food or a quality of food or a type of oil, I would also want to do that. But everybody is doing this, eating this, so I would also want to eat that. Now, there is something called as really misinformation in the society. So this goes by hear and say. So we also believe in treating diabetes by hear and say. So if you just heard it from somebody, and if it doesn't match with your age, with your body type, with your society, with your culture, and with your reports, with your inner body, your any complication, that advice, that piece of advice from whoever it is come may not be for you. This is an era of individualization. This is an era of customization of diabetes. We are in an era of precision medicine. So we need to be very precise and concise and tailor to the needs of that particular patient. So that's how I think society would play, and you need to talk to your endocrinologist for your proper treatment for diabetes.
Thank you. Since you just mentioned about misinformation, what are the most common myths that you have encountered during your practice and how do you manage such challenges?
Okay. I think the first and foremost is that myth is, this is not my report. This report is wrong. How is it possible? I never had diabetes. I don't have any symptoms. But my dear, 51% of diabetes is detected when it is in an asymptomatic stage. And that's the boon that you have, because that's where we avoid complications, that where we treat you even before entering into medicines. And if you are just a borderline diabetes person, or if you are having pre-diabetes as it's called, it is easy to do reversal. It's called as hit early, hit hard. I think that's one of the myths, that it's not my report. So that's denial. Then otherwise, we also have a very big myth that if diabetes means that's the end of life, end of day, and I will not be allowed to eat so many things. No, diabetes teaches moderation. Diabetes teaches discipline. And we allow to eat a lot of things from different cuisines, provided it is, again, individualized for your daily needs, for your kind of activity that you do, for your kind of control that you have, and your targets that you would want to. So that is discussed with the doctor, that these are my goals and this is how I would like to set it and dedicate it in that manner. Another thing is that I have heard that this is good for diabetes. I think that needs to be scrutinized, that needs to be talked to the proper qualified doctor, and then take the advice from there. So everybody may not be really okay with going with certain myths, but some people do not treat diabetes till the really very end or till they have a problem. Some people really wait. They feel that, for example, if there is a wound and it is not healing, they take it as a part, because I am not covering it properly, or because I'm just walking on my own heel, if there is an wound, that's why it's not healing. So self rationalization sometimes also creates a problem in the management of diabetes. But denial is the most important one, I feel, because the moment you become aware that you have a problem, that treatment is half done already.
With the recent advancements in technology, how do you see diabetes management evolving in the next 5 to 10 years?
Superb question. I think I would like to answer in two ways. One is advances in devices. We have flash glucose monitoring, we have continuous glucose monitoring, we have wearable devices. These devices detect the variation or the variability in glucose, how high or how low it can go. Earlier, we had devices which were put on the tummy or on the hand. It's like size of a 1 rupee coin for 3 days, for 4 days, or for 14 days that we have. Earlier, we also had device which was only with the professionals, the machine one, and both used to be blind, but a patient also and the doctor also. When the patient only used to come back, we used to recheck and see. But now we have the device which the patient can buy and also check anytime that they want to. A lot of people have started using that. And treatment advances, we have a lot of treatment which can give mortality benefits, the benefits in the terms of longevity, the benefits of morbidity, the benefits in terms of complications of diseases. For example, like SGLT2 inhibitor drugs, for example, GLP-1 receptor analog drugs. And again, there are drugs by this year end, November, December, would again come to India, which are weight loss drugs, especially, which would reduce the mere incidence of diabetes also, because people would lose weight and maintain it on that. Of course, the cost of these newer drugs are going to be high, but my suggestion always is for a lifestyle modification, because that is something which is going to be ever evolving. And also, one important thing, whatever advancements come, whether it's a diet or an exercise or a device or a drug, please discuss with your doctor that what is right for your body. I think that decision should be combined. It should be a shared decision making. We are in again 2023, and that's important for you to live diabetes diabetes longer and happier and a complication free life.
Since you just spoke about the advancements in technology, can you also discuss about some ongoing research or clinical trials that you find particularly exciting or promising?
There are many. I think every month there are thousands of papers coming for diabetes, and it would be very unfair on me to talk about one and not to talk about another. But overall, as I said, these researches should be taken in the view of that how it is going to impact on me. So, for example, diabetes and kidney disease, there have been a lot of advances, and there are a lot of newer treatment tablets which are there, where we can prevent the end stage kidney disease. We can prevent patient going into dialysis. We can even prevent diabetes and kidney proteinuria that happens. We can even prevent at the normoalbuminuria stages. So this is one just example about the kidney, but there are again studies about the heart, about the brain, about the cholesterol, about the blood pressure, a variety of things that we have.
Thank you so much for your time. It was a wonderful session. Thank you for it, sir.
Okay, thank you so much. Thank you for inviting me.
Thank you, sir.